Welcome, everybody. Today we have Tull Roseby with us, and he's from DailyCare Australia. He's going to be talking a little bit about caring for someone with dementia. Welcome, Tull.
Thanks, Andrew. Nice to be here.
Terrific. So let's get started. First question I have for you. So let's begin by asking, what are some of the common paths that end in people asking this question? How do I care for someone with dementia?
Okay, Andrew. So dementia really describes a collection of symptoms that are caused by disorders affecting the brain. It affects people's ability to think and communicate and remember things. And I think people need to understand that living and caring for someone who has dementia can be difficult. It's really a change to a lifestyle. Some people find using whiteboards with dates on it really helpful. Routine is really important as it keeps those with dementia on a familiar path. And dementia has a few warning signs. Memory loss is a common sign for people who are affected, as well as difficulty with familiar tasks and not knowing where they are or even how they got there.
Right. Okay. Thanks, Tull. Next question I have is, when a prime carer suddenly realizes that they have to quickly make some important decisions that will affect their loved one, what are some of the common feelings prime carers face with?
Yeah, it's a really good question, Andrew. And I think strong emotions can arise when caring for somebody with dementia, as it's often challenging for families to accept and deal with. It can cause them to become confused and anxious, even suspicious of those around them. And this can cause distress and worry for family members. And often when a prime carer is forced to make important decisions relating to the care of their loved ones, it's a time when they're stressed and they're dealing with a lot of emotions about the situations and also still needing to look after their own direct family. At that time, families can really benefit from getting support through that process to actually find the right type of care.
Right. Thanks for that answer, Tull. Now, the next question I have is if you could tell us a little bit about what the options are for a prime carer when they find themselves in the situation of caring for someone with dementia.
Sure. So it really depends on how far the dementia has developed. And I think the first port of call really is, having a look at in-home care. That could be the best first option. But then some, then some decisions really need to be considered. Is there an immediate family member that will be the lead caregiver? And if there is, he or she will also need some support from other people, maybe other family members that are reliable. But often, as I mentioned before, when people are the primary caregiver, they've often got their own families in terms of younger children. So looking into outsourced in-home care options is something that is an option for people. It depends on the level of care required, of course, but it can be far more convenient and a comfortable option for some people affected with dementia. And the next step really is, in cities and larger towns, there are typically a lot of aged care facilities in most people's local areas. But remembering at times that availability can be tight, so people may not be able to get the placement in the facility straight away that they want. And of course, people want to ensure that the care quality is of the highest possible standard.
Some great advice there. My next question, what are some of the common problems and challenges prime carers come across when deciding on care solutions for someone suffering dementia?
Yeah, good question. Dementia is more than just having forgetfulness, as people commonly think. Memory problems are certainly a component of dementia, but communication and emotional and behavioural problems are often also present. Depending on the person, wandering issues are common. Hallucinations and delusions can also occur, and caregivers are often taken by surprise when their loved ones are suddenly thrusted with problems in these areas, especially if they're early symptoms where memory is a problem. If these issues do occur, I think the best port of call really is to go to your local GP. They may also recommend the local aged care assessment team. And if residential aged care facility is the best option, then the next step is to find one that provides a right level of care. Remembering what I said before, availability can be challenging. So sometimes, even whilst you're waiting for an aged care facility, in-home care might be the best option. And also, just as a side note, just remembering when you're going to an aged care facility, it also means that you need to consider the financial and cost circumstances as well.
Very true. Okay, if you could tell us a little bit more about the in-home care for dementia sufferers, what kinds of home services are available and who are providing these services?
Yeah, well, I think in-home care is really important because familiarity is important for a person with dementia. Staying at home with a partner can provide the best living environment. In this case, respite care can be helpful. And there are home care providers that can support people with dementia, ranging from those basic needs through to high level of care. Consumers can choose from government-based care, which means you need an assessment, which is a government-based assessment, but they also might attract a waiting list. Or there is also private care, which is fully funded by the consumers themselves, but it means you can probably get the care when you want it and how you want it. Also, just to make note that in a few months, in early 2017, the Australian government is also introducing a concept called consumer-directed care. This means that consumers who do have a government package will have more choice as to the providers that can care for them.
Right. Okay, thanks for that answer. Now, I just have one more question, Tull. You're the founder of DailyCare. Can you tell us about the service that you provide and how it can help prime carers needing to care for a loved one suffering dementia?
Sure, Andrew. So DailyCare was born because at the moment in Australia, there's no platform that connects consumers with the right care at the right time. The idea behind the site was it provides a comprehensive guide to in-home care services and aged care facilities across states and territories in Australia. And once people enter a few key details of their needs, the website provides a tailored list of options which are specific to a family situation. Those options can be shortlisted into what we call a care summary that then can be reviewed and shared by a family to support a really confident decision on the right care for that particular individual.
Terrific. That sounds fantastic, Tull. Well, that's all the questions that I have for you today. I'm sure that people who find themselves in this unfortunate situation will get a lot of value from the information that you've given us. So I appreciate your time.
Thanks, Andrew, very much. I really appreciate your time.